So I'm curious about your recent opinion piece that you and Dr. Zeke Emanuel and some of your other colleagues on the Biden transition team as pandemic
Mhm.
advisors. One of the conclusions you drew was, and I'm going to quote here, after previous infectious disease threats, the U.S. quickly forgot and failed to institute necessary reforms. That pattern must change with the COVID-19 pandemic. Without a strategic plan for the new normal, with endemic COVID-19, more people in the US will unnecessarily experience morbidity, mortality, health inequities will widen, trillions will be lost from the US economy. This time, the nation must learn and prepare effectively for the future. So, my question to you is, so what is the new normal? What does it look like?
Well, first of all, we don't know. And anyone who doesn't admit that, be careful because they probably have a bridge to sell you too. Humility right now is a very, very key component of what we know and don't know and what we are trying to find out and how we're communicating that to the public. I've already mentioned the fact that we could have new additional variants that could emerge that could evade the immune protection of our current vaccines and that of natural immunity from infection with Omicron or Delta, and could be highly infectious. There's no reason that that can't or won't happen. So we have to be prepared for that eventuality. We could be going through an Omicron situation again. Now, no one wants to hear that,
Mm.
but that's really important. We know that. At the same time, we may find that this was the last of the major variants to emerge, and that anything after this will be a tweak on what already exists. Then we're going to see a new normal where we get back to doing what we were doing, still probably, I'm sure, with some questioning about what it means to be in a public space. But I think because we don't know what the answer is and people want answers, we have to be really clear in saying we have to plan. To me, I look at this almost like some of the best well-funded fire departments in the United States are in major metropolitan airports. Yet, if you look, most of these airports have never had a plane go down on the reservation. They may have gone down in adjoining areas, cities, etc., but we wouldn't run these airports for one day without those really important and well-funded fire departments. Well, we have to run a public health system, a healthcare system too, that could in fact accommodate another Omicron-like variant should it emerge. So we have to build on that. On the other hand, if it doesn't happen, that's great. The other piece of this, which I think is, to me, gives broad daylight hope, is the fact that I think we will see version 2.0, 3.0, and 4.0 in the vaccine world. I think we're going to see vaccines coming down the pike that will replace our current vaccines, which are remarkable. They are remarkable. They're just not perfect. And what we need are vaccines that have much more durable immunity, long-term. They have a broader breadth of immunity. So if new variants emerge, they still will be effective, much like we're trying to achieve with universal flu vaccines. So that's number one. Number two, if we had this conversation in the early 1980s and we talked about HIV, it would be a death sentence. It was a death sentence back then. Today, HIV is a manageable chronic disease for many, many people. And I think with the drug therapies that we're looking at going forward, I think they can be highly effective once someone is infected in reducing the likelihood of severe disease, hospitalizations, and deaths. But to do that, we're going to need a comprehensive testing system that everyone has ready access to that can quickly give back a result so that we know that they're infected with COVID and that we can then get these drugs to them, which means the drugs have to be available and they have to be in the system so that it doesn't take days or weeks, if at all, to get them. If we can do those two things, improve on our vaccines and surely improve on how we deal with therapy, we can do a lot of what we accomplished with HIV. We can turn a very bad situation into a manageable one. And I think that's what's going to happen in the future.